there nystagmus? We would all agree there's nystagmus here. Which way is it beating? This is not a political question. Is it beating to the left or to the right? Because I'm neutral, it's going to change direction. So it's beating to the left. Now, what's happening now? It's beating to the right. It's kind of the way the world is going. But every 2 minutes, this nystagmus changes direction. And I'm sure someone knows what this is. This is, you know, in neurology, you describe things, the name of the disease is what you see. This is periodic alternating nystagmus, or PAN. Typical lesion of nodulus produces this. And yeah, so I won't spend a lot of time on this because it's a little complicated, but there's a treatment for this. And that's why I think it's so important that you know about it. What causes this weird nystagmus? So we have centrally what we call velocity storage mechanism, which helps the periphery to, it makes the signal coming from the periphery more faithful to what the head is doing. And then we have an adaptation mechanism in the brain which tries to make nystagmus go away. Don't worry about the mechanisms, but the important point for you is to remember is when you have a cerebellar lesion, this mechanism becomes unstable because you've lost inhibition from the cerebellum, and this comes from the nodulus, and you can treat it simply because you're missing GABA when you have a lesion in the nodulus, so you just give GABA. And the way we give GABA is essentially to give patients baclofen. So baclofen is a medicine which in the vast majority of these patients with acquired periodic alternating nystagmus stops the nystagmus.